Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.
Now, what are cost measures that consumers need to know about? Now, for many consumers, a trip to the doctor is a painful thought, especially when it comes to the costs associated with it. But there are ways to help control how much you need to spend to get the quality care you need, and the hospitals and insurance industries are trying to teach consumers what is the best way to get the help within the system without overspending. So, Sherry, I'll start off with you. What are some of the ways that UNC is trying to educate consumers?
Well, UNC, along with other healthcare systems across the state, are very interested in people getting the right care at the right place at the right time, and of course the right cost. And what contributes to that is uncompensated care for the uninsured. So we encourage people to get coverage. And the second thing is understanding and using those benefits wisely, which includes, and services, which includes a variety of things as well. So how do I use and pick a plan and decide about what's good for me and my family? It's so personal, and we try to support patients and consumers in that. And then also around the service utilization, we really encourage people to talk to their physicians about, when do I use the emergency department? When do I come to your office for care? So really understanding those nuances of benefits and using services. It's so important to not only use it for patient experience and to increase that, but to also really help with that cost issue.
And Mary, of course, you've got many consumers. What are some of the things you're trying to educate them on?
We do. We have a host of tools available to members who can look up how much it costs to go to different places. We also have a nurse line that is open 24 hours a day, 7 days a week, where people can call to try to determine which the appropriate place of care is. We promote our networks a lot so that individuals know that they're visiting a doctor or a hospital that's in network. It's significantly lower costs if you visit in-network providers as opposed to going out of network.
And of course, what are some of the ways or other ways consumers can control their health care costs, especially for planning for the upcoming year of enrollment?
One thing I would say, Mitch, is that it's very important as soon as somebody has selected a health insurance plan to look at which doctors work with that plan and pick a doctor before they have an emergency and go visit that doctor for a healthy checkup. We have found a lot of people that are buying their own plan for the first time may not have gone to the doctor a long time, and when they go, they might find they have a new condition they didn't know they had, and they can get treatment in advance before it becomes an emergency. And so that's very important. And then they have that resource of that doctor's office to go to ask about their health insurance, to get help understanding it, but also to go there to ask, where is the right place for me to go for this treatment, or if this situation occurs to me or my family. So I think planning ahead in terms of going when you're well to a doctor and picking a doctor before you're sick and in an emergency is really important.
And also making sure that you have a plan in place.
Yes, getting enrolled is critical, and we're entering open enrollment periods for the health insurance marketplace. And when people, and Sherry has mentioned this, that when people are looking there, they want to talk to an expert, an agent, a broker, or a federally funded assister. They're available all over the state, and find out which doctors work with each plan so that they can pick the plan that includes doctors they want to go to.
Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.